Parkinson's disease is a progressive neurological disorder that primarily affects movement, but it can also impact mood, behavior, and cognitive function. It occurs when nerve cells, or neurons, in the part of the brain responsible for movement, the substantia nigra, gradually break down or die. These neurons produce dopamine, a neurotransmitter crucial for coordinating movement, and as dopamine levels decrease, it leads to the symptoms characteristic of Parkinson's disease. Causes and risk factors. The exact cause of Parkinson's is unknown, but both genetic and environmental factors are believed to play a role. Genetics. Around 15% of people with Parkinson's have a family history, and specific genetic mutations, e.g., LRRK2, PARK7, PINK1, PRKN, and SNCA, are linked to the disease. However, these mutations are rare and account for a small percentage of cases. Environmental factors. Exposure to certain toxins, e.g., pesticides, herbicides, and heavy metals, has been associated with a higher risk of Parkinson's disease. Age. Parkinson's primarily affects older adults, with most cases occurring after age 60, although early onset Parkinson's can develop in younger individuals. Gender. Men are slightly more likely to develop Parkinson's than women. Head trauma. A history of significant head injuries may increase the risk. Symptoms. The symptoms of Parkinson's disease vary widely among individuals, but they generally fall into two categories: motor symptoms, those affecting movement, and non-motor symptoms, those impacting mood, cognition, and other bodily functions. Symptoms often begin subtly and worsen over time. Motor symptoms. Tremor, often the first symptom. Tremors typically appear in the hands, fingers, or arms and are more noticeable at rest. Bradykinesia. Slowness of movement. Movements become slower, making everyday tasks more difficult and time-consuming. Muscle rigidity. Stiffness in the limbs and trunk can cause discomfort and restrict the range of motion. Postural instability. Poor balance and coordination may lead to unsteadiness and falls. Changes in gait and posture. People with Parkinson's often develop a shuffling walk and may lean forward while standing or walking. Non-motor symptoms. Cognitive changes. These may include difficulty with planning, organizing, and problem-solving. Some people may develop dementia in the later stages. Mood disorders. Depression and anxiety are common, often appearing even before the motor symptoms. Sleep disorders. Insomnia, vivid dreams, and REM sleep behavior disorder. Acting out dreams frequently affect individuals with Parkinson's. Autonomic dysfunction. This can cause issues such as constipation, urinary problems, and low blood pressure. Loss of sense of smell, often one of the earliest signs. This may appear years before motor symptoms. Fatigue and pain. Many people with Parkinson's experience general fatigue and pain, often from muscle stiffness. Diagnosis. There is no specific test for Parkinson's disease. Diagnosis is typically made based on medical history, symptoms, and neurological exams. Diagnostic steps may include physical and neurological exam. A neurologist evaluates the patient's motor skills, muscle tone, reflexes, and coordination. Levodopa challenge test. Since Parkinson's symptoms often improve with levodopa, the standard Parkinson's medication, this test may confirm the diagnosis. Imaging tests. DAT scan. Dopamine transporter scan. This specialized imaging test can measure dopamine levels in the brain, helping to distinguish Parkinson's from other disorders. MRI or CT scans may be used to rule out other conditions that cause similar symptoms. Treatment. Although there is currently no cure for Parkinson's disease, treatments are available to manage symptoms and improve quality of life. Medications. Levodopa/carbidopa cinnamate, the most effective medication for controlling motor symptoms. Levodopa converts to dopamine in the brain, while carbidopa helps reduce side effects. Dopamine agonists. Medications like pramipexole, ropinirole, and rotagotin mimic dopamine effects in the brain and can help reduce symptoms. MAO-B inhibitors. These medications, including selegiline and roxadulin, slow down the breakdown of dopamine in the brain. COMB inhibitors, entacapone and tolcapone, are used alongside levodopa to prolong its effects. Anticholinergics. These are sometimes prescribed to help with tremors, especially in younger patients. Amantadine, used to manage symptoms and sometimes prescribed for dyskinesia, involuntary movements caused by long-term levodopa use. Surgical treatments. Deep brain stimulation (DBS). This procedure involves implanting electrodes in specific parts of the brain, which are then connected to a device that sends electrical impulses to reduce symptoms. DBS is typically recommended for patients who do not respond adequately to medication. Lifestyle and supportive therapies. Physical therapy. Exercises designed to improve balance, flexibility, and strength are beneficial. Occupational therapy helps individuals adapt their homes and daily activities to enhance independence. Speech therapy. Since speech can be affected, speech therapy can assist in improving voice volume and clarity. Regular exercise. Aerobic exercise and strength training can help maintain mobility, reduce stiffness, and improve overall well-being. Diet. A balanced diet rich in fiber can help with constipation, and adequate hydration is essential for overall health. Complications. As Parkinson's disease progresses, it can lead to several complications. Motor complications. Prolonged use of levodopa can cause dyskinesia and wearing off effects, where medication becomes less effective. Cognitive decline. Dementia may develop in advanced stages. Mood disorders. Depression and anxiety are common, as are hallucinations and delusions. Sleep problems. Sleep disturbances, including REM sleep behavior disorder, are common. Increased fall risk. Postural instability can lead to falls and fractures. Swallowing difficulties. This can lead to choking or aspiration pneumonia. Prognosis. Parkinson's disease is a chronic, progressive illness, and symptoms generally worsen over time. However, the rate of progression varies widely among individuals. With proper treatment and lifestyle adaptations, many people with Parkinson's can maintain a good quality of life for several years after diagnosis. Current research into Parkinson's disease is ongoing, and promising advances include gene therapy. Trials are exploring how introducing specific genes into brain cells might reduce symptoms or slow disease progression. Stem cell therapy. Stem cells are being investigated as a means to replace damaged dopamine-producing neurons. Neuroprotective treatments. Research into drugs that protect or repair dopamine neurons may offer future benefits. Conclusion. Living with Parkinson's disease can be challenging, but a combination of medical treatments, lifestyle adjustments, and support systems can help manage symptoms and improve quality of life. Early diagnosis and a proactive approach to treatment can make a significant difference. Those with Parkinson's disease, their families, and caregivers can benefit from education, support, and access to resources to help them cope with the disease's complexities.